Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something that worries a lot of people, getting called back for an ultrasound after a mammogram. First, let's take a breath together. Being asked to come back for an ultrasound does not mean something is wrong. In fact, it's a very common and normal part of breast imaging, and most of the time it leads to a reassuring answer. So why does this happen? A mammogram is an X-ray picture of the breast, and it's fantastic at spotting many changes, but it has some limitations. One of the biggest reasons for a follow-up ultrasound is something called dense breast tissue. Breast tissue is made up of a mix of fatty tissue and firmer glandular tissue. On a mammogram, dense tissue shows up white, and so can some abnormalities. This means dense tissue can sometimes hide or overlap with something the radiologist wants to look at more closely. Ultrasound uses sound waves instead of X-rays, and it's especially good at seeing through that dense tissue to get a clearer picture. Another common reason is that ultrasound helps tell the difference between a fluid-filled cyst and a solid area. Cysts are extremely common, especially as hormones shift throughout life, and they are almost always harmless. But on a mammogram alone, it can be hard to tell if something is a simple fluid-filled cyst or a solid spot that deserves a closer look. Ultrasound answers that question quickly and comfortably, often within just a few minutes. Sometimes an ultrasound is requested simply because the radiologist saw an area that looked slightly different from the surrounding tissue and they want another angle, another tool to understand it fully before deciding on next steps. Think of it like this. A mammogram gives one very useful view of the breast, almost like a single photograph. An ultrasound adds another view, like looking at the same area from a different angle with a different camera. Using both together often gives a much clearer, more complete picture than either one alone. It's also worth knowing that ultrasound doesn't use any radiation. It's painless and it usually takes just a short amount of time. The technologist or radiologist will apply a bit of gel and gently move a small handheld device over the area in question, watching the images in real time. Now, I want to be clear about something important. Being called back for an ultrasound is not a diagnosis, and it's not a signal that something serious is definitely going on. Studies show that the vast majority of callback ultrasounds after a mammogram turn out to show normal tissue, simple cysts, or benign, harmless findings. The whole point of this extra step is to get more information so that your doctor has a complete and accurate picture rather than guessing based on incomplete information. Here's a practical takeaway. If you're ever asked to come back for an ultrasound after a mammogram, try not to jump to the worst case scenario. Instead, think of it as your care team being thorough and careful, using the right tool for the right question. It's a sign of good, careful medicine, not a red flag. Of course, if you do have specific concerns about your own results or your own breast health, the right move is always to talk directly with your doctor, who knows your history and your images and can guide you personally. Thank you for spending this time learning about your breast health with me. Taking a little time to understand what these tests mean can make the whole experience feel a lot less stressful and a lot more manageable.